Many of our students report not feeling fully prepared when they graduate to make patient care decisions, and more than 23% of them are involved in an adverse event within the first year upon graduation. Now, this was data that was released back in 2017, but the statistics are still very strongly aligned with this same percentage of adverse events. Welcome back, everybody, to Dr. Sellers Educate. We are continuing our series and looking at alignment of the QSEN competencies, the AACN essentials, and our NLN nurse educator competencies. If you haven't already, make sure you subscribe to this channel so you will be notified right away when a new episode is launched, which usually happens every single week. All right, so there's a few data points I want you to keep in your mind and go ahead and write down on your study worksheet. Okay, you can find a copy of the study worksheet right here in this episode description so that you will stay focused on content by writing down your learning objective as well as today's date. Okay, so 250, I want you to keep that number in mind. Another number I want you to keep in mind is 440. Okay, so write those down, 250 and 440. In this snapshot, we're exploring the impact, specifically the impact that we can have as nurse educators to engage our students in hardwiring the continuous quality improvement process into their everyday work. We want to have transparent conversations in our classrooms. We want to integrate some of these evidence-based practices that we'll be talking about that are already described in our QSEN competencies as it relates to quality improvement, the AACN essentials, and our NLN nurse educator competencies. Okay, so let's take a look at this website. So you can find the link to the AHRQ website right here in this episode. There's some fascinating information here, and I encourage you all to take some time to look at the specific content that may be relevant to integrate into your course. I'm actually teaching right now a quality improvement course, and it's very interesting the conversations that we're having. A big focus that my students are assigned to do is using a graphic organizer and looking at the data that is included on this website. The wonderful thing about this website, as you can see, this is data from 2022. So every single year, this comprehensive report is released by AHRQ, and it spells out how our hospital systems are performing. All right, so let's take a look at this next slide, and then we'll get to our crosswalk. 250 measures. That is what is stated on the AHRQ website when you go to the introduction page. So it says here quality is described in terms of 6 priorities. So we have patient safety, person-centered care. Some of these terms sound familiar, right? They are strongly aligned with the QSEN competencies: care coordination, effective treatment, healthy living, and care affordability. This report, or the report, is based on more than 250 measures of quality and disparities covering a broad array of healthcare services and settings. So, in all fairness, the website does say more than 250. And in fact, right now, when we go over to the website, you will see that the presentation deck that AHRQ has put together on their website actually reports that there are now, at least in the 2022 report, more than 440 metrics of quality and data points. Okay, so let's take a look at what we will be focusing on in these series. We are focusing on one objective, which is that you will be able to demonstrate alignment with the nurse educator competencies, and that's for CNE, CNE novice, and CNE clinical, to increase application and analysis. All right, so now what we're going to do is go ahead and go to our thought-provoking question, and then we'll head over to our crosswalk so that you can write down on your study worksheet some key elements to help you close your knowledge gaps. All right, so here we go. Quality indicators of care are measured and reported on every hospital with much information available for public review. What role does data play in the nurse educator's role to teach students about continuous quality improvement? A, exhibits a spirit of inquiry about teaching and learning in nursing. B, central to identifying areas for enhancement and monitoring progress. Or C, identifies the role of research in nursing policies and clinical practice. All right, so that's our thought-provoking question. And what will happen is we will come back to this thought-provoking question at the end of our time together in this snapshot. All right, so now we're going to go over to our crosswalk, and I am using Prezi. I don't know how many of you have used Prezi before, but what I love about it is how it floats the presentations. Well, it was over here, I think, back and forth, and it makes you feel more like you're in an actual interactive classroom, having the presentation slides at your shoulder. So it does kind of increase engagement a little bit more, I think. All right, so now I'm going to share my screen. And what you will see happen is we're going to take a look at the actual documentation. Here we go, of the crosswalk. And before I go there, I just want to share with you the report that is located on the AHRQ website that we looked at a screenshot of earlier. Okay, so this is the actual report. It's so nicely done, and you can see there that it says that the presentation even includes notes. So again, strongly encourage you all to take advantage of this wonderful report and to integrate it and align it with your learning objectives with your students. Okay, this is a great assignment for a flipped classroom where students are using active learning and aligning with the andragogy framework, where students are being self-directed in their learning as described in Malcolm Knowles' adult learning theory. They're taking responsibility for seeking out information as adults. Okay, that's what andragogy is all about. All right, so you can see here that this report 2022 says that there are more than 440 measures of quality and examines data in 3 sections. Okay, so you can see how the 3 sections are spelled out. I want to bring to your attention in this report 2 really critical areas of concern related to the healthcare in the United States. And it's the 2 M's is what I call them. The first is maternal health. This report summary says the U.S. has worse maternal health and healthcare than any other industrialized nation, pointing to suboptimal maternal health outcomes for multiple measures, as well as considerable racial disparities. Okay, and I know that's not a surprise to us because we've been hearing about it on the news for quite some time. This is a critical element that we should bring into our nursing students' learning experiences. We want to pull out this data, we want to review it with our students so they can really see the impact nationally, not just locally in the hospital where they are at, which by the way is another great activity, but we want them to see the level of care that is being provided to our moms and to talk about the changes that we in nursing can move forward with in order to decrease the poor outcomes that we're seeing for maternal health. All right, so the next M that we're going to talk about is mental health. This report states here that the rates of emergency department visits with principal diagnosis related to mental health diagnoses per 100,000 population increased by 24.6% for children ages 0 to 17 years between 2016 and 2018. Now look at this next data point. The rate of death from suicide among adolescents ages 12 to 17 increased by 70.3% between 2008 and 2020, rising from 3.7 to 6.3 deaths per 100,000 population. So you can see this is definitely a cause to sound the alarm for us in nursing education, to really embrace this as an opportunity for us to educate our students, to integrate this information into our curriculum so students can have an increased awareness of where we are in the United States as it relates to mental health and maternal child health. In the interest of time, we're not going to go through all of the other wonderful data points that are summarized in this report, but again, I highly encourage you to take some time to take a look at this report and to identify ways that we all can integrate this into conversations we're having with our students and in the clinical setting as well. So not only in the classroom, but also in the clinical setting. All right, so now we're going to move over to our crosswalk. If you all have not had a chance to take a look at the crosswalk yet, I highly encourage you to take some time to look at that. And that also is in the description, the actual crosswalk between the QSEN competencies, AACN essentials, and then We are going to release our crosswalk once we have completed it, but I do want to share with you right now where you can find the information for yourself. All right, so what you're going to see now come on your screen is going to be a couple of different tabs. The first tab is this crosswalk that we have been walking through over the past 3 weeks. And then the next tab, what you're going to see is the actual website, which is the QSEN website, where the crosswalk work was already done. Amazing work that the team did in aligning QSEN, and now they're not so new anymore. They were released in 2021, the new AACN Essentials. Okay, and then this last tab is the website that we were referring to earlier. This is how you will get there. Again, the link to this actual website is included right here in the description. So let's go back to our crosswalk and talk through where we are today, which is going to be on quality improvement. This is Snapshot 129, and if you didn't get a chance to check out the previous snapshots yet, we focused on community and patient safety in Snapshot 125. Snapshot 126, we focused on patient-centered care. 127 was teamwork and collaboration, and then 128 was evidence-based practice. We will wrap up our final snapshot for the QSEN, AACN, and NLN alignment next week. All right, so quality improvement. What you should see on your screen now is going to be alignment with, I know it may be a little overwhelming, but I want to pause here for a second and say, what I want you all to do is go ahead and pull out your detailed test blueprint, or you can go over to your certification portal if you're already certified. Because remember that we want you to tune into this channel if you're on the certification journey or recertification journey, or even if you just want to be a better nurse educator. We're here to support you to achieve nurse educator excellence wherever you are on that journey. So what I want you to do is, first of all, not get overwhelmed, because there's more than a dozen of behaviors, and this is just literally a snapshot. There are far more competencies that are mapped to quality improvement than what we have captured here, okay? But we just want to bring to your attention just a few of them to help you close your gaps. So the first one is aligned with all 3 of nurse educator competencies, which is facilitate learning. So specific behaviors is that we're using teaching and learning strategies based on educational theories and evidence-based practices. The next one is that we're able to apply concepts of EBP and nursing to guide teaching. The one that's specific for CNE novice under facilitate learning is being able to engage in self-reflection and continued learning to improve teaching practices that facilitate learning. Okay, and then you can see here other ones are going to include, for CNE novice, facilitate learning development and socialization. For CNE and CNE novice, being able to pursue continuous quality improvement in the academic nurse educator role. Now for novice, it just says in the nurse educator role, okay? But it's still focusing on these specific behaviors around self-reflection and responsibility that we have of ourselves to identify ways to improve our learning experiences that we are developing for our students in the classroom. And then scholarship, drawing from literature, implementing the scholarly activities, and disseminating the information that we discover. And then clinical, for the CNE clinical standpoint, being able to facilitate learning in the healthcare environment, where we're able to apply teaching strategies from educational theory and evidence-based teaching practices. So we are integrating those evidence-based practices to help support the learning experience in the healthcare environment. And then last is the translation of theory, as faculty being able to translate that knowledge, transfer that knowledge to our students by role modeling, by describing some of the experiential opportunities that students have, maybe even as we talk about unfolding case studies in the classroom, aligning those case studies with the actual clinical experiences, especially in post-conference, to kind of, again, connect the dots with our students. This is why it's so important from a faculty standpoint that we work closely with our didactic faculty and our skills lab faculty to understand what is it that students will be focusing on week to week. Okay, that's going to help us better align the experiences that students are going to have. And then the next column we want to look at is going to be hallmarks of excellence. These are Specific behaviors, you can find that link right here as well in the description, that NLN has identified as achieving excellence in our nursing program. So it aligns with Hallmark 1-1 and 1-2, being able to engage students to exhibit a spirit of inquiry themselves, discussing and empowering students to commit to lifelong learning, and CQI to achieve excellence. So some behaviors that may show up in our classroom could be that we're asking students to include a reference whenever they are engaging in our discussion boards. Even in the classroom, if students are able to bring in a current event or literature article that is aligned with our learning objectives for that classroom experience, it really is going to role model these scholarly activities that we want students to be able to demonstrate for even beyond their graduation point. Okay, we want them to embrace opportunities for improvement individually, as well as supporting and collaborating with the healthcare partner once they graduate to move changes forward that are needed. Next is Hallmark 3-1, building this culture of continuous quality improvement through the role modeling of integrating activities like we talked about as it relates to citing references, but also discussing the accreditation standards when it comes to our regulatory agencies. As a good example, with when we have CCNE accreditation, talking to students about the different elements that are required for us to meet the different standards that we have to meet in our nursing program. Hallmark 5-1, creating innovative evidence-based approaches to facilitate learning, using those strategies that are going to help facilitate the learning process with our students, making sure that we are using formative feedback with them, that we're using a variety of evaluation strategies and not only exams, that we are integrating quizzes so students can receive feedback throughout the course and be able to adjust their study habits or maybe the resources they are using to improve their scores. And then here's a good question you want to consider under Hallmark 5-1. In what ways do I appraise evidence that support my selection of strategies to facilitate and evaluate learning? So what is the research saying about the evaluation strategies that I'm using in my classroom every day or every semester? Is there an opportunity for me to make changes? The next category is looking at the QSEN domain, which is simply the definition of quality improvement, is that we use data to monitor the outcomes of care processes, and we use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. Now that's a lot of responsibility. So what does that all mean? Well, one strategy that we can use is through our advisory boards. We know that during the advisory board meetings, whenever that happens at your institution, we're able to engage with our healthcare partner about our students, our graduates, and our current students about their performance in the clinical setting. So this is a great opportunity to talk about strategies or even opportunities that we want to consider when we think about changes to our curriculum, okay? Or maybe things are going great, but we just want to engage in that conversation with our healthcare partners during our advisory board meetings, during any other meeting, or during our actual clinical experiences if we are serving as clinical faculty, making sure we have a solid relationship with the manager or educator of the unit so we can have transparent conversations about how we can partner to address any issues that may come up. All right, so that's what quality improvement is all about. Oh, my mouse is getting a little happy. Next is going to be the KSAs. Okay, so these are the QSEN KSAs that are identified with the QSEN AACN Crosswalk. So the specific ones that are aligned with the topic that we're discussing for this snapshot, K or knowledge is going to be students being able to describe strategies for learning about or improving the outcomes of care in the setting in which one is engaged in clinical practice. And it is mapped to the domain, the NLN is the actual essentials, I should say, domain of person-centered care, scholarship for the nursing discipline, and then some assignments that you want to think about related to KS, the actual knowledge component could be patient care plans. Okay, so this is the next column that you see, it lists out teaching and evaluation strategies. So that could be one example. And then creating a flow chart, that's another example as well. An exemplar that I wanted to share that is used in a course that I teach, although it's at the graduate level, so you'll want to consider modifications based on the level of students that you are teaching. The assignment is that students are to consider the outcome and process measures that can be used for CQI. They actually write a paper, but you could easily, and part of the process too in the class, is that they do start with a discussion question about process measures versus outcome measures and how it relates to CQI. Okay, but in this paper, they're listing 2 process measures and 1 outcome measure. And then they're describing why each measure was chosen. So why did they choose them? They're providing an explanation of how data would be collected for each. So how would each be measured? And then they're adding an explanation of how success would be determined. They are including 1 or 2 data-driven, cost-effective solutions to the challenge of that specific patient care situation. Okay, and then they're using a minimum of 3 peer-reviewed scholarly references as evidence. So you can see some of the expectations listed out in this assignment that we've kind of talked through during this snapshot. Next, we want to go to skills, or the S. Students are using tools such as flowcharts, cause-effect diagrams to make processes of care explicit. And the attitudes example is value measurement and its role in good patient care. Okay, so students being able to demonstrate that. So for skills, it is aligned with domain 3 and domain 7. And then for attitudes, it's aligned with domain 5 for quality and safety. Students being able to apply QI principles in care delivery. All right. And then they could also create a flow chart when we talk about skills related to patient care or quality improvement initiatives. The resources that we have used for this episode have primarily been the Crosswalk, but also Billings and Halstead. Remember that for active learning, chapter 17, specifically starting on pages 286 through about 290 or so, you're going to see some excellent descriptions of those active learning strategies. And then evaluation is also in Billings and Halstead. Table 24.1, page 457 is going to give you some great examples of evaluation tools and strategies that we should use. Other evaluation strategies and teaching strategies that you want to think about, I encourage you to go ahead and write those down now, because that's part of this process too, is just for you to take some time to reflect on how your current teaching practices and the evaluation strategies you're using right now in your classroom, how they align with this crosswalk. Are there improvements that you want to make? Or could it be that you're going to give yourself a round of applause because you're already doing such an excellent job? And lastly, I appreciate you all staying with me, is we're going to take a look at our thought-provoking question. So let's see how you all did, okay? Let's take a look. So if you chose B, you are correct. So B was the correct answer. Central to identifying areas for enhancement and monitoring progress. That is the strongest answer, even though, yes, it could exhibit or help stimulate a spirit of inquiry. Possibly. It could help us identify whether or not there's an opportunity for research, but the most appropriate answer, because remember the question was about data. What role does data play in our role to teach students about CQI? And if this was one that you didn't choose correctly, I want you to do 2 things. First of all, I want you to make sure that you've written down those Billings and Halstead pages to help you identify some of those evaluation and teaching strategies that are going to align with evidence-based practices. And then number 2, I want you to go back and take a look at the AACN Essentials and the Crosswalk for QSEN. And then once we release the full crosswalk that we've developed to add the NLN, Nurse Educator Competencies, and that will happen next week after our final episode related to the QSEN competencies. And I want you to look at these documents to really help you clarify any muddy points that you have. With every question, if you're on the journey for CNE, with every question that you get to, we want you to think about 2 things. Number 1, what is the question asking me? And number 2, what do I know for sure about this question? Okay, and just remember that as of right now, you can skip a question and go back. Okay, so we don't want you to spend too much time on one question. Think about what is it that you know make a decision, and then move on. Okay. You can always reach out to us, info@drsowlerseducate.com. Check out our website. We're excited to roll out our next session of the fall series that will be coming up. And then we also have a live masterclass. We have one in November and we have one in December as well. So we hope to see you there, and reach out if you have questions. Thanks, everybody. Have a great week.